Hello and welcome to Oran Kivity. Today we're introducing Ontake Method, a precise and gentle Japanese heat-based treatment method. Oran is a British acupuncturist. He has been practicing since 1987 and have been trained in Europe, China, Japan, and is a founding member of the Toyohari UK. That means that you, Oran, and I are colleagues in the Toyohari Association. So I would like to introduce Oran, and hello and nice to see you.
Hello there, Lars. Thank you so much for getting up early in the morning. It's my lunchtime and it's about 6:30 in the morning in Denmark. So
That's right.
appreciate it for you.
Yeah. Sorry for my...
Yeah, so I'm going to do what I call Ontake 101. So I'm going to basically do a short presentation and just introduce your listeners and viewers to what Ontake is. And then after that presentation, if you have any questions, Lars, you can ask me about them. And then I'll do a second presentation on the treatment of midline pain. Now, this theoretical model is not confined to Ontake, so you might find it very useful in your practice to think about these kind of this kind of model for treating midline pain. And by midline pain, I mean throat, sternum, pubic symphysis pain, sacral pain, spinal pain. So any of those areas on the midline can be treated with this model. And of course, I'm going to show you how to do it with Ontake. So that will be, I think, useful for all of you, whether you want to study Ontake or not. And then when Lars sends this out, I think I'll ask him to put in some links to some videos of Ontake for pain relief. So check out the email. There's some links if you'd like to see more about Ontake. Okay, that's it. That's the introduction. So let's start off by talking about what is Ontake. So I have got a little video here, and you can see in the box, if I get out of the way, that it's a small piece of bamboo and you stuff it full of moxibustion. And you tamp it down with a baton to make it flat and smooth, and then you light it. And then once it's lit, it becomes warm, and you can apply it anywhere on the body using a number of theoretical models. And so, yeah, you can use it on the face. It's a very good way to apply moxa to the face without wounding or burning anyone. And you can apply it anywhere. The most common for me is on the back. Okay, so it's a piece of heated bamboo. And as you could see, it's more like a moxa box. It's like a tiny little moxa box. It's very mobile. It's very rhythmic. And it's very agile. So you can apply it very easily with your hands. And it's safe and simple to apply. And that's very important, is the simplicity, and it's easy to learn, and it's very safe to apply. Now, some of you will be thinking, oh, this must be some kind of ancient moxa tool handed down from antiquity, but actually it's not. The first mention of it in print is in 1992 by a guy called Makoto Yamashita, and it's possible that he was using it as early as the 1960s. But in his book, he says, oh, there's this new moxa tool, and you apply it locally to treat pain. Then some of you will have heard of Fukaya sensei, Izaburo Fukaya, who was a very famous 20th century moxa practitioner. And he had a son called Hideo Shinma, and Shinma sensei wrote about it in 2012. So as you can see, it's really the new kid on the block. If you imagine the timeline of acupuncture being thousands of years, then this is just like 50 years, maybe. So it's been around a very short time, and it's only really become popular in the last 10 or 15 years as a moxibustion tool. So it has very many applications. If you want to, you can use it for your root treatment. So you can use it to regulate the whole body and to trigger an immune response. So for regulation. But its most common use, both as far as Makoto described it and as far as I see it, is as a branch treatment. So, if someone has sinus problems, then you can work on the forehead and around the nose to treat the sinuses. Or if someone's got digestive problems, you can work locally on the abdomen. And also, it's tremendous for pain relief. And for pain relief, it's very spectacular. So if someone has pain in the elbow, then you'd use another part of the body to trigger change in the elbow. Someone's got pain in the back, you use another part of the body to get relief in the back. And it's really spectacular for this. And I'll talk briefly about that maybe in a coming slide. So then it can also be used as like a complementary or adjunctive treatment. So there's your kind of acupuncture treatment, and you think, oh, this person's a bit spleen deficient. And then you could just work on spleen-related areas like the back shu points as a supportive treatment to help with your acupuncture treatment. We use a number of theoretical models with Ontake. And the first comes from a guy called Dr. Manaka. And some of you watching this will know that because you're studying Manaka in Aarhus. But Dr. Manaka was a Japanese doctor and medical practitioner and acupuncturist who was very interested in research. And one of the things that he came up with was frequencies of beats per minute that the meridians respond to. And so without trying to intellectualize it, I can just show you I can play you the meridian frequency for bladder channel, which is 112 beats per minute. I don't know if you can hear that. No, let me see.
No.
Yeah, there we go.
That comes.
So this is the frequency of 112 beats per minute. So you can apply Ontake at 112 beats per minute when you're working on the bladder channel. Another theoretical model is deficiency excess. And deficiency excess, we talk a lot in Chinese medicine about deficiency excess. The liver can be excess, it can be deficient. So what I'm talking about is deficiency excess as perceived through touch. So when you stroke different areas of the body, you find that some feel deficient. So, for example, muscles might feel sunken or caved in, or they might feel swollen and raised up, or the skin might feel cold, or it might feel hot. So balancing deficiency excess in terms of what you find through palpation is an important theoretical model for Ontake. So where it feels cold, you warm it up. Where it feels hot, you do more kind of dispersing techniques with the Ontake. Another thing is holographic models. Now, you're all familiar with holographic models, like the ear reflects the whole body. So when I needle a spine point on the ear, it affects the corresponding region of the torso on the spine. So there are lots of holographic models, including Hirata's models or Dr. Tan's models of normal mirror, reverse mirror, where you can roll with Ontake on the limbs and affect pain in the torso. Or you can roll on the opposite limb and affect pain in the opposite limb. So if I've got pain in the elbow, I can roll on the knee or vice versa. So Ontake can be used with these holographic mappings to tremendous effect. And that's why it's so good for pain relief. Now, the last thing I'd like to say about the theoretical models is that they're not like a cuckoo that comes into the nest and displaces all the other eggs. So Ontake is not going to displace what you already know. What it's going to do is it's going to dovetail very nicely with what you do. So if you do TCM acupuncture, then it dovetails very nicely with TCM because you can use it as a branch tool. And if you do Manaka acupuncture, then it dovetails very nicely with Manaka acupuncture. We're already using Manaka's meridian frequencies. And if you do Dr. Tan, then yes, you'll understand some of the holographic models right away, and you can use Ontake instead of needling. So it integrates with your practice. It's not like you have to unlearn anything. It's just an add-on tool. Okay, so let's take a closer look at an Ontake. So this is an ontake, and you can see that it's a tube of bamboo, and it's been filled with moxibustion at both ends, and one end has been lit, so there's smoke coming out. And you can see, if you look at the lip, that the lip has been rounded, so you can press with the lip. So it's very versatile. You can apply it with the lighted mouth. You can apply it with the side. You can roll with the side, or you can actually hold it in your hand and strike percussively, like a kind of tapotement with the side of the bamboo. And also you can press diagonally with the lip. So you can really press, like doing friction in massage. So it's a very versatile tool. And you can make them yourself. They're easy to make if you can get hold of bamboo. So the external diameter should be 3 to 3.5 centimeters. Any bigger than that, and it starts to burn a lot of moxa very quickly. And the skin should be 3 to 4 millimeters thick. So a little bit thinner than that, it gets too hot to hold, and too much thicker than that, and it becomes, it just doesn't get warm enough to have its therapeutic effect. And overall, it's about 5 centimeters in height. So that's what I call the standard ontake. There are actually some longer ontake as well, but that's the standard ontake that I use. Yeah, I have some mini ones that I use with children and use on the face, and some longer ones that I use when I want a little bit more leverage. Let me show you one. Yeah, here's one. So that's a longer super ontake. That was developed by a guy called Philip Caude in Spain. Okay, so that's all I'm going to say really about what is ontake, to introduce you to ontake. And what I'm going to do next is do a presentation on sore throat and midline pain. But in the meantime, Lars, you might have some questions. So
yeah, maybe you will clarify this later, but when you showed the ontake, it seems like you only use the bamboo to touch the patients. You do not actually make any cauterization of the patient with having the moxa touch them. Is that right?
Okay, yeah. So if I can hold this up so you can see to the camera, you can see that the moxa is set back from the lip of the bamboo. So you're not, when you touch it directly to the skin, you're not branding the skin.
No.
You're just creating a lovely sensation of warmth. So it's an indirect moxa tool. It's not direct in the way that a rice grain cone of moxa is, which burns directly on the skin. So you're not trying to blister the skin. You're just trying to warm the skin. And the interesting thing about working with ontake is that we don't work with acupuncture points so much. What we do is we work with regions and lines. So you're always tapping in lines and rows. So that's why those holographic models are so useful. So yeah, that's a great question.
Thank you.
Okay, so let me summarize what I've talked about so far. Our key concepts are that ontake is like a mobile moxa box, and it can be used to regulate or balance. And we use meridian frequencies. And what I'm going to do now is to introduce a simple theoretical model, which actually can be described as Dr. Manaka's octahedral model in a nutshell. So, as you know, we have heaven up here and we have earth down here, and we stand in between the two. So heaven, person, earth. And if you imagine an axis coming from heaven down to earth and dividing the body in half, then we can imagine this line dividing left and right. And then if you imagine another vertical axis coming from heaven down to earth and splitting the body in half, but this time it's splitting the body from front to back. And finally, you can imagine another axis which is coming from left to right at the level of the navel, which is splitting the body into two halves, upper and lower. And that's actually the function of the daimai in acupuncture. So what we can say is that these three axes of yin and yang create what we refer to in anatomy as the sagittal, frontal, and transverse planes of the body. And if you look at my little man, you'll see that he has four anterior quadrants. These axes create four anterior quadrants and then four posterior quadrants. In other words, there are 8 octants, four anterior, four posterior quadrants. So there's 8 altogether. And that is the basis of Dr. Manaka's octahedral model. Now, what that means is that if these are all yin-yang related, is that if I treat the front half of the body, then it's going to affect the back. If I treat the upper quadrants, then they're going to affect the lower quadrants and vice versa. If I treat the front quadrants, they're going to affect the back quadrants and vice versa. And if I treat the left quadrants, they're going to affect the right quadrants and vice versa. And we can combine upper, front, left opposites so that we can be treating all over the body three-dimensionally. And this is essentially Dr. Manaka's octahedral model. So what does that mean for sore throat? Well, if you think of the sore throat, then it's superior and it's anterior. So it's in this upper 2 quadrants here. And if it's on the midline, well, then it's directly on the midline. But sometimes sore throat is worse on one side or worse on the other side. So, I've got a sore throat, but it's worse on the right. I've got a sore throat, it's worse on the left. So what we want to do in order to treat it is find, according to quadrant theory, we want to find the opposite quadrant. So if this is superior and anterior, we want to look posterior and inferior. And that's what this looks like. We end up on the sacrum. So that's very interesting. So the sacrum can affect the throat, and the throat can affect the sacrum. And we can use these in a useful way. And what we can also consider is channel pairings. And we can think about internal, external, and we can think about yin and yang. So to treat sore throat, let's think about what channels go through the throat. And I can enlarge this for you there. So yeah, you can see that you've got the renmai going through the throat, and the kidney channel, it stops at kidney 27, but has a deep pathway which goes to the root of the tongue. So that can be very useful. And then if we think about the channels that go through the sacrum, well, there's the bladder channel, which is internally, externally paired with kidney. And there's the du channel, which is internally, externally paired with the renmai. Well, not internally, externally, but yin-yang pairing. So you can see that the sacrum then has some very dynamic pairings for us to consider when we are treating sore throat. Okay, so what I'm going to do now is play you a short video, and we'll go into that. The first thing you want to do is check the sacrum for reactions. By reactions, I mean areas of hot and cold, or puffiness, or areas of pressure pain. So make a note of those reactions, and those are what we're going to try and treat. So we're just going to light our bamboo. And we want to make sure it's not too hot. So just tap against the palm of your hand and then against your wrist. If it's comfortable on your wrist, it should be comfortable on your patient. And we'll start by tapping lightly with the bamboo. And then you can get your patient to swallow and see whether there's been a change in the sensation of the sore throat. Then you can start to do rolling. Rolling is slightly deeper. So just rolling with the bamboo, working into the tissues of the sacrum. And once again, you can stop, you can get the patient to sit up and swallow again and see if there's been any change. You can also roll longitudinally along the line of the sacrum. Now, sometimes the sore throat will be more on one side than the other, and we want to treat the opposite side. So if the sore throat is on the left-hand side, you want to focus on the right-hand side of the sacrum. If the sore throat is on the right-hand side, you want to focus on the left-hand side of the sacrum. And if the sore throat is right in the middle, you focus more on the midline. So let's assume that someone has sore throat on the right. We would be rolling slightly more on the left here. And once again, check for reactions. If the pressure pain has changed, then you can finish. Okay, so I hope that video helps and you can see how palpation and how the location of the Ontake can affect the distal area just through these models. But actually, this is not the only way, the only kind of opposites that we can think of, because if you imagine that you got a stake of bamboo and put it through your heart around Ren 12, then if you were to raise the bamboo, and let me show you with my drumstick. So if this is a person, then if the bamboo is going directly through the person, then when you treat here, you're affecting here. And if you treat the upper anterior part here, you're affecting the lower posterior point here. And if you go the other way, then if you're treating superior posterior, you're affecting down here. So just think of Dracula when you're doing this and imagine this state going up and down, and it's like anywhere along the spine is affecting anywhere along the front, and anywhere along the front is affecting anywhere along the spine. So this is the basis for treating midline pain. And let me show you what that looks like. So if someone has pubic symphysis pain, which is inferior and anterior, then you should be up somewhere around here on the upper back. And if someone has mid-back pain, then you're just treating opposite the mid-back pain. And then you should all be very familiar with this. If someone's got pain in the inguinum, like or hemorrhoids, then we treat using Do20. So this is something very familiar to you. You put a moxa stick here, where you do moxa here to kind of draw things up. So it's exactly the same principles of opposites. Okay. So I think that's all I'm going to say about treating midline pain, and I think the video makes it clear. And yeah, I think we can stop there. So let me just get rid of this and go into discussion with Lars.
Yeah. Oh, that is very interesting. Well, all of the pairing of the meridians and stuff like that is well known in acupuncture in all different styles, as you have said. But it really made it clear that the Manaka octahedral model is quite clear the way you showed it, and that's very helpful for those who know Manaka and uses Manaka, and also maybe other persons. What I'm thinking about right now is that, are you using a special kind of moxa for it?
Yes. So Most people in the West are familiar with the kind of green moxa that you put into moxa boxes, or that is what is in a moxa stick. And that's a
Hmm.
fairly coarse and twiggy kind of moxa. But actually, the moxa that we use for Ontake is more refined than that. It doesn't have any twiggy bits that can fall out when you're doing this kind of percussive technique. So this is called medium refined moxa. And the typical one that is Japanese medium grade moxa is wakakusa moxa. So that's used also for warm needle technique, where you put the ball of moxa on the end of the needle. I would say one thing more about this, your first comment, which is that yes, this is useful for Manaka practitioners, and yes, this is useful for people who do Ontake. But this model of midline pain can be used by any system of acupuncture. You can needle those points if you want, or you can use a moxa stick and pressing if you want. But I would say that this rolling on the sacrum with Ontake is my go-to method for treating sore throat. And it just anyone with a sore throat, then that's what I'm going to do. I'm going to do a root treatment, make sure the pulse feels nice, and then I'm going to go in there. I'm going to be rolling on the sacrum until the throat feels better. And it usually just takes a couple of minutes. So it really is a very, very powerful pain relief tool, just using these opposite pairings of yin yang and opposite pairings of areas. I think it's a very powerful tool.
So your practice is that you have noticed that it's more effective to use more distal points for instance, throat pain than going directly.
Yes, I think it is. I think it's a question of leverage. If someone has sacral pain and I find points on the hand, then I'm using all this leverage of my arm and the channels in the arm to affect the sacrum. So it's like using a seesaw. Like the fulcrum is over here, whereas if I'm working directly on the thing, then the fulcrum is here. Also, I feel that in a lot of pain, there's inflammation involved, in chronic pain and acute pain, and in that case, I don't want to do moxa directly on the site of the inflammation. But I can do moxa away from the site of the inflammation and get this tremendous leverage on pain relief. And that's really why I use Ontake all the time, is for pain relief. It's so great for that.
Do you have any thoughts about issues with using warming moxa on different patients who does not need the heat, or do you have any precautions there?
Yes, I have some Japanese theory around that, because I think traditional Chinese medicine teaches us to be very fearful of using moxa in hot conditions and in deficiency heat conditions. And this comes from herbal thinking, where if you have a hot condition, you shouldn't have warm foods. You should have cooling foods. So it's basic yin and yang thinking. And on one sense, in terms of moxa, it makes sense. So if you're using a moxa box is really hot. You put moxa inside it, you stick it on the skin, and then the person says, oh, that's really hot. And you move it, and the skin is red and sweating. So no one is going to deny that that is a hot technique. But if you look on the other end of the scale, then you've got rice grain moxa. And rice grain moxa in Japanese acupuncture is not considered heating. It's considered stimulating. So you're stimulating a point by creating this micro burn. So what that tells me is that the rules for moxa change depending on the moxa technique that you're using, and that we should not make one size fits all rule for all moxibustion techniques, because they're so different. The effect of a moxa box, a moxa stick, moxa on the end of the needle, and ocu and Ontake are all different. And what Ontake does is it warms the skin. So afterwards, you can see that the skin feels warm. Sometimes it's a little bit red, but rarely, depending if you've rolled hard or not. So this is not a heating technique in the sense that you need to think about yin deficiency or excess. What you need to think about is in terms of regulation. How are you going to use Ontake to trigger the body's healing mechanisms? And so that's my answer to that, is I actually treat a lot of deficiency heat conditions with moxa.
Yeah. Okay, so you think that the Ontake is triggering the Seiki in the body, which is a natural healing process that we're all are part of.
Yes, absolutely.
Yes.
And your goal, and I think the goal of Toyohari and the goal of Manaka is to trigger this Seiki. So to regulate the body, to stimulate a healing response in the body. And then so the Ontake is not curing anything, it's just triggering the body to do its thing.
So this video here is about that we have invited Oran to come to Denmark to teach, and he is teaching the Ontake Moxa on Monday and Tuesday, the 16th and the 17th of March in Holmesen in Ebeltoft, Denmark. It is on a Monday and a Tuesday because Oran have been teaching on our Manaka course the weekend before, but that course is full. But we have Oran here. We are very happy to have him to teach Ontake. It had been on my bucket list for a long time. So welcome, and I hope to see a lot of you together with Oran in Ebeltoft at the 16th and 17th of March. Oran, can you please tell a little bit about what the course will be about, so everybody knows the topics you're going to go through and how we are going to work with them?
Okay, so it's a 2-day course, and during the first day you're going to learn how to load Ontake with moxa, light it, and apply it rhythmically with Dr Manaka's frequencies. And I'm going to teach you a whole body routine that you can use for regulation, but it's basically going to be a very, very practical class. I really hate to do long blocks of lectures, so I talk a little bit, we practice a bit, I talk a bit, we practice a bit. So there'll be a lot of practice on day 1. On day 2, we're going to talk about pain relief specifically. So how do you relieve pain with Ontake? And we're going to use Dr. Tan's models of normal mirror and reverse mirror, normal image and reverse image. And we're going to see how we can adapt them, these ideas that were in acupuncture 1, 2, 3, for Ontake. So I call this Ontake 1, 2, 3 in deference to Dr. Tan. And then we'll talk about treating common conditions. So anxiety, diarrhea, sinus problems, skin problems. So how can you treat them with Ontake? How can you apply them? So day 2 is very much about treating the branch. Day 1 is about learning how to apply Ontake and treat the root. So, and then we'll finish off talking about dosage, because I think dosage is an important lecture, and particularly in terms of Ontake. So yeah, that's what we'll do for the 2 days. So very, very experiential. And when you go away, you will be able to apply Ontake in your practice. So the next day you will be able to use it, and I guarantee you that your patients will love it. So that's the beauty of Ontake, is that patients really love it and they ask for it all the time. So yeah, that's what you'll come away with, the skills to apply Ontake.
Now I'm looking even more forward to meet you again, Oran. So thank you for coming here, and I hope to see a lot of you in Aarhus, Ebeltoft, Denmark.
Great. Thank you very much for having me, and I'm looking forward to coming.
Yes.
Free audio post-production by alphonic.com.